I can just remember sitting in my office and people come in and they say to me, so what is your real objective? What's your mission? What do you want to see have accomplished? And I've been trying this last year to get more and more of this done because I know that the conventional medical authorities, other doctors, are never going to accept, no matter how wonderful, no matter how many thousands of patient successes we present, no matter how many broad studies we show of people getting better, it's never going to work unless we have legitimate protocols where you follow people in controlled trials for disease-specific applications. You can't just show people getting better. You have to do a study of all of migraine headaches. You have to another study all of lupus patients, another study all of people with type 2 diabetes, then type 1 diabetics and follow them. Then just do a study follow people who are over a period of years and see what kind of outcomes they have with regard to reduction from cancer. In other words, we need to, in order to really change society, we have to produce studies. And I sat down, a lot of my patients, go to other doctors and they start to see things happening. People with autoimmune thyroiditis or hyperthyroidism go back to their endocrinologist and they're all better. And the doctors are amazed, and then some of them are calling me up on the phone and they say, we have to do some research together. This is amazing. A doctor who's a surgeon at NYU calls me up, and NYU, he says, this patient was supposed to have her colon removed for colitis, and now she's better and doesn't need even to have her. He says, this is amazing. We got to do a study together. And all these people, and finally, a group at the University of Pennsylvania called me down and with a whole table of physicians from the University of Pennsylvania School of Medicine around a table. They saw a bunch of my patients who were slated for eye surgery for diabetic retinopathy and macular degeneration, that they had to cancel their surgeries because they got well in a very short period of time, and they were amazed. So they called me down and they produced this after we spoke. They were very intelligently, respectfully, and some of these people were like reading my books and asking me to autograph the book, and they changed their diets, and these are people who were my teachers in medical school. Really cool. And they put together a grant and submitted $1 million grant to the National Institute of Health to do a study with diabetic retinopathy and macular degeneration with the University of Pennsylvania School of Medicine Eye Institute down there. I think it's called Shea Eye Institute. And the National Institute of Health, where they were very positive. They said we put together a 40-page paper, very scholarly written grant proposal was written, and they were very confident we would not only get the approval, but we'd be able to actually have a place where the people could come for food to make sure they eat the diet. We'd have food available for the people to make sure they were compliant. It was very the concern of these doctors. So to make a long story short, the NIH turned down the grant, and now they're producing a new grant. In the process, we've done 4 self-funded studies this year, some pilot studies, because we need some pilot studies done to get bigger funding and grants. And so we've produced a study on the changing perception of hunger, a diabetes pilot study, and we've worked on the migraine study, and we've done a survey study on autoimmune condition. We did a member survey study and a white blood cell study. We started some studies going on right now. And so we're working on protocols, but we're finding out that to get studies published in major journals, obviously, and you really be associated with major universities, with the right type of researchers, the right type of IRB approval, and research protocols to do the blinding and enough people to make them acceptable, to really change the face of American medicine, we have to design a series of studies, and each study costs over $1 million to do. So I spoke with various people, of my friends, and how are we going to do this? And Peter Max designed this nice poster for us. We got the nutritionalresearch.org started, designed the website under the auspices of the National Health Association, a 501c3 with 50 years in existence of doing charitable and nutritional work. And now, so now I'm going to bring Jerry Deutsch up to introduce him, the president of the National Health Association, how excited we are, which we're doing this. We're just launching this new project, and our first project, which we're starting next year, is a heart disease reversal study with carotid ultrasounds, which doesn't expose people to radiation, where we're measuring at least 50 people in each group to study the reduction of atherosclerosis on a nutritarian diet and the degree of reversal you can get in a short period of time with both a control group that could change the face of medicine.